Hello, good evening, everybody. Thank you for being here. I am extremely thrilled to be moderating this session. It is, I think, the only all-women's panel that we have here, and we have a really distinguished set of panelists. And as already mentioned, we are going to be talking about a very interesting topic today. It's a marriage between nutrition and health and CSR. And by the end of the discussion, I think there's one thing that I'd want you guys to take back, and that's a learning, which is what does CSR corporates look at while they're engaging with nutrition? What is the objective with which they go on for designing their programs? What is the thought process? And also some of the challenges. So without further ado, I will deep dive into the questions. And because Archana is sitting at the last, I will ask you my first question, which is how relevant is the theme of nutrition for corporates when they are looking at sponsoring CSR projects? Since you've worked in that space now for so long, what would your insights be for that?
Thank you, Neha. Good evening, everyone. It's nice to see. It's nice to see that you all made time to show up here, despite the fact that we're not giving you nutritional bars or something of the sort. I mean, everybody's probably gone for chai or something like that. But I'll just introduce myself very quickly. I represent the Telangana government, and I lead the CSR wing in the state, which essentially means that we connect 600 plus corporates to 200 plus NGOs and 35 government departments. So what we offer is pro bono services, okay? So these are free services. And I have to just say that sometimes there is this, acha, government hai, so there is a certain perception, okay? I mean, where is the money going? And, those questions, it's just natural for those questions to pop up. So I'm just, setting the record straight that, these corporates deploy money into the state of Telangana across the 33 districts. And this is through the NGOs, right? The NGOs are the implementation partners. So to answer Neha's question about where the interests lie of corporates, in my experience, I've been working for nearly 19 years now, and a good number of those years were spent in the development sector. Most corporates opt for education or health because they are low-hanging fruit, right? Most corporates are willing to say that, look, we'll do educational infrastructure ramp up or digital literacy tools or STEM education, and the education piece is very much in demand. And we saw that in the morning as well when Bhaumik was taking us through those slides. I mean, education continues to be a very preferred area of corporate support. Health is second, at least in Telangana, that's the sense we get. A lot of corporates come to us and say, इस general hospital में हम लोग ये MRI machine डालेंगे या फिर we'll give you vacuum pumps. So there is that area also that is of interest. Nutrition as such per se single-handedly is not asked for categorically by corporates, but a lot of PSUs will say health and nutrition ka theme hai is saal, so please give us projects in that space. So typically, I hope you've understood the business model. I have corporates who will come up to me and say that we have, like, for example, 50 lakh rupees to deploy. Where should we deploy? And I usually nudge them to deploy in the districts, right, in the rural areas, because all of us sitting in this room, most of us have had on-the-ground experience, right? All of us have worked in the districts. We know that real help is actually needed in the rural areas, right? I mean, the cities are sitting pretty, like they say. But Neha, I hope I have answered your question. There is, that's how it is. Nutrition per se is not asked for, but health and nutrition as a theme comes to us, public sector undertakings in particular. And a lot will depend on the awareness levels of the corporates. If they know that this is a growing need, they will step up to help. That's it. Thanks. Do you want this mic?
The mic comes to me and stops working. Okay, it's working now. No, absolutely, I agree with you. And actually, you know, you're right. Like a lot of people, when they want to fund, they're looking at education and then they're looking at health, and that's how you see the funding, the spending also. But you, Usha, are supporting some of the nutrition projects, right? So would you talk to us a little bit about why is it important to support nutrition and some of the programs that you've been leading on that?
Thanks, Neha. Am I audible? Good evening, everybody, and thanks for your time. And it's a privilege and honor to be with you all. Hello.
Just hold it closer.
Am I
Yeah,
audible now? Yeah. Uh, Pleasure and privilege to be with all of you today, this evening. And as part of Cognizant Foundation, I have been working on the healthcare sector for the last 5-6 years, but I've been in education, just to say and add on to what Archana said, in other verticals also in the foundation. So close to 20 years of experience for me in the development domain. And I should say, Cognizant Foundation has supported 600 plus projects in the last 19 plus years with 300 plus partners in 10 states. With this note, I would like to reiterate that moment of unimaginable joy is felt when a mother is placed with a newborn in her hands. And that is a joy and an experience which is a right for the mother, for all women. But in India, that moment doesn't reach many of the women, folks, just for the fear of delivery and labor. Primary reason is pregnancy-related complications, which play a major role and lead to maternal mortality rates and infant mortality rates. And the irony is, it is many times significantly preventable and treatable. Though India has made significant feat in terms of bringing the MMR and IMR in the last 2 decades, but still there is a lot of life coverages, access and digital divide issues in the system. And as corporates, I strongly feel as part of our healthcare interventions, we have to complement the government initiatives and not intervene, strategize, standalone programs, because it is not sustainable and it will not live for longer on the community. This is the note, and I would also like to bring the facts and stats from the WHO that 46% of maternal deaths and 40% of IMR deaths happen during the labor or in just 24 hours after the labor immediately. And nearly 3.5 million preterm babies are born in India every year, and out of which almost 1 million babies go through the special intensive care units or the neonatal care units. Reasons again is nutrition, which is hidden behind, whereas they are at a higher risk of stunted growth, developmental disorders, delays and issues. So I, from the corporate ecosystem, strongly advocate that CSR health initiatives and to also tell this audience that Cognizant Foundation, though it's an IT major company, has taken healthcare as a very strong pillar of intervention, and we advocate on healthcare initiatives. But when we started in Cognizant Foundation, we started with preventing avoidable blindness. As an organization in health, we started only doing childhood prevention programs. But in that, we were doing screening and treatment for ROP. I don't know how many of you know about ROP, which is retinopathy of prematurity. A neonate needs to be screened within 4 to 8 weeks of time after the birth for the eye condition called retinopathy of prematurity. If the baby, it may occur on a full-term neonate or on a preterm baby because of birth-related issues in the labor room. And if not screened on time, there is a 100% chance that the baby would lose the eyesight. So we took that project and we started working, and then I came to the facts and learning on the ground. Why I question why this is happening in the country and where we are not addressing. When I went to the hospitals and checked on the intensive care units and special neonatal units, the primary reason was preterm deliveries, which had landed up from high-risk pregnant mothers, lactating mothers, and high-risk children, which is during the antenatal care and the prenatal care. Immediately, so until 2019, we were working on this. So based on the learnings, we came back to the boardroom and we strongly advocated for preventive community health programs, which is nothing but sensitizing and creating awareness on anemia screening, nutrition-sensitive interventions, care for antenatal and prenatal programs, and more importantly, on lifestyle changing dietary intake interventions. This may always take an underrated element in any program, but the current GDP, the current expenses that the country is investing on healthcare is actually could be reduced if higher intervention measures are put on this nutrition-related initiatives, and every dollar spent on nutrition-related initiative in low and middle group countries would lead to almost like $16 investment in ROI made, because you are bringing down the healthcare related resource intensive expenses in the tertiary healthcare by addressing this in the community. I think I have addressed the question, Neha.
Absolutely. And also like so many facts that you've left us with for us to go back and think about. Just to add to that, every dollar spent on nutrition intervention actually is $16 in ROI, but it's almost $35 in SROI. So social return on investment is much higher. And also, Usha, you made a very interesting comment on how nutrition is a multi-sectoral approach, and you can't work on nutrition if you're standing alone. And that leads me to a question to Dr. Dhanlakshmi, which is, you've worked for so many years in this space. What is the role and the importance of collaborations and partnerships to drive nutrition projects?
Thank you, Neha. Before I get to answer your question, a quick 2-minute sneak peek into what we do as an organization. So I am from Bayer. I lead the CSR for Bayer Group of companies in India. And our mission is health for all and hunger for none. Being an organization that's so deeply rooted into crop science, pharma, and consumer health, it comes as a natural, mission. And we work on it through different ways. And one initiative that I would like to mention specifically about nutrition that we're doing is a nutrient gap initiative. This was an initiative that was started 3 years ago, and happy to share that India is one of the pilot countries that we are looking at to roll out this nutrient gap initiative. And what we're doing in this initiative is, for all of us, I would say about 70% of our nutrition comes from the food that we eat. Cereals, fruits, vegetables, nuts. And the rest of it, the 30%, is what we would need to supplement through vitamin and mineral supplements. So that is the narrative with which we started the Nutrient Gap Initiative. And today we have a couple of partners with whom we are working in India to expand and scale this particular initiative. And going back to what Neha asked in terms of the multi-sectoral collaborations. See, basically, what we believe, one, is preventive health. That's extremely important. And the second is, nutrition is such a complex subject, it cannot be looked at in isolation. There needs to be multiple, departments that need to work together. A basic thing for nutrition, water. If we do not have clean drinking water, what's happening to the nutrition? So we need to think about that. So water is one thing. Sanitation. So that's the other important thing that adds to the aspects of nutrition. So that's why, when we say that nutrition cannot be looked at in isolation, but you need to have multiple components to look at when you think about nutrition. Water, sanitation, and also the social protection aspect itself. So that's another important angle to bring in. And to me, women are the core of nutrition. And Usha very nicely, mentioned the joy that is there when you hold a baby, right? And when you hold a healthy baby, there can be no joy other than that. So I think these are all certain components that come in. And Usha also mentioned how we need to complement the government initiatives. See, for any program, if we have to move the needle, if we have to bring scale, there needs to be partnership. We cannot work in silos, we cannot do anything alone. So it's extremely important to have these partnerships. The government is there, they come up with wonderful policies, they have a lot of programs, especially in India, if you look at the nutrition programs that we have. It could be the Poshan Abhiyan and the ICDS scheme, that is one of the oldest schemes that we have in India, especially for child nutrition. And now we have Anemia Mukt Bharat, Tuberculosis Mukt Bharat. So a lot of different such schemes that the government has put forward. So now I think it is for the rest of the universe to come together and join hands with the government, the public sector, and then the private sector. It could be through their funding. Then you have research organizations. You have organizations or startups that are working on innovative technologies. So you need all of these to, come get the program to scale. But one of the most important player in this entire scenario is the community. So we need to have, the buy-in from the community, the counseling to the community, and the behavioral change that the community needs to think about when they think about nutrition. So it's extremely important for us to have all these players and partnerships together. And to just put it in one simple line, it is a partnership from grassroots to the government.
Thank you. There is power in the collective, and I think that's what you're also trying to say. She brings a great point on the community. It is really the last beneficiary that we are looking towards through these programs. And Sanjita here is an expert on SBCC. So I'd just like to ask you, why do you believe integrating SBCC in some of these nutrition-focused programs, why is that critical and how is that crucial?
Thank you for that question, and I would actually like to thank Dhanalakshmi that you pointed out a very relevant, underlying element of behavioral change that often gets missed out, in our programs, particularly CSR-funded programs. So before I dive into the answer for this question, I'd quickly like to introduce my organization and what we focus on. I represent Center for Communication and Change India, which is Johns Hopkins CCP's sister concern or the sister organization based in New Delhi in India. And as the question to me has been on social and behavior change, all our work is actually on this particular concept, whether it's the capacity strengthening around social and behavior change or the application of SBC in implementation, on-ground projects, and so on. So the entire life cycle of a project, how can SBC be integrated into the different phases is what we specialize in. Now moving on to CSR funded projects, there's great work going on all over the country when it comes to CSR organizations pitching in. And I would actually say that nutrition is another, I would say, a big thing that CSR organizations are investing in. But what's been missing so far is the focus on communication, the focus on behavior change. Unfortunately, what we see on ground is that communication or behavior change is looked at as a spare wheel, right? Once the program is done, there would probably be a minuscule budget to let's develop a few posters or let's develop a few videos and so on, right? But actually, it should start from the behavior change itself. What are we advocating the community to actually practice on ground, whether it's related to anemia, whether it's related to malnourishment, whatever the behavior we are targeting, it has to start with the key vision that we have for what we want the audience, in which case the community, to actually practice. And the other challenge that we notice is that communication or behavior change is often looked at as a one-shot thing. That today I've engaged with the community, or if I've organized an awareness generation campaign, it's done, I've checked the box, and that's going to bring me results. Again, CSR-funded projects are so focused on the economic impact of the investment that we have made that they forget that these are cyclical processes. You can't really say that today if I've invested so many dollars in a behavior change program or in a nutrition program with a vertical of communication, it's going to come back to me with this level of return economically. We have to keep doing it over and over again to get the results, because just like us, the community's needs are dynamic, right? And another thing that I very commonly see is that we look at our audience, and in which case, again, the community, the people that we are working with and working for, they're looked at as some kind of a demographic profile, right? So children under the age of 5, or women in the reproductive age group, or men in a certain age group. We never really see that who are these people behind the demographics. We are not really looking at the psychographic profile of people. For example, we encourage pregnant women to, regularly consume IFA tablets. But how are we packaging that message? Are we saying that, you need to have this because you're pregnant? Or are we saying that it's important for you to consume this so that you have a healthy baby and you stay healthy yourself? Right? So that's just a very basic example of how we can actually repackage the behaviors that we want people to adopt in a very sort of creative and audience-centric fashion. And the last thing that I would want to focus on is the life stage approach to behavior change. Unfortunately, a lot of programs that we work on are focused on the overall project objectives very sort of strictly, almost in watertight compartments, right? We don't really see that at the beginning of the cycle of life, if we invest, that's going to give us returns in the other stages or the subsequent stages of life as well, right? So if a child is born with a low birth weight, that investment hasn't reached the child in the first 2 years, 3 years, 10 years, that child is going to grow up and become a mother, a pregnant woman. And then again, so that's like a cyclical process. And we need to invest in communication. We need to invest in behavior change from the very beginning of the life cycle of our projects, as well as the life cycle of our audience. So we have to maintain that continuum of care vis-a-vis nutrition from the very beginning.
Absolutely. I feel like how nutrition is a multi-sectoral, topic to deal with. It's also, there are multiple pillars that you need to work on. So there's supply, there's system strengthening, but there's demand generation, right? And I think increasingly many organizations are kind of like putting aside some funding for that. There's a very big clock looking at me, and it's really ticking. But I do want to get a few more questions from you guys. Archana, can you talk through, you spoke about so many NGOs empaneled within the government for so many projects. Can you talk through some of those projects, or at least one of those projects which is, which has done very well, which has shown good impact on ground?
Yeah, so in Hyderabad, in Telangana, there was this one CSR project that we just closed. We signed the MOU in September 2024. So a pharmaceutical company gave 6.5 crore rupees for this nutritional project, which will feed 28,000 plus children in Vikarabad district from 312 schools for for 1 year. So that's a massive amount that's come in for a nutritional project, so to speak. This is by the implementation partner, the NGO partner here is HKM Foundation under the Akshaya Patra umbrella. Everybody here knows that Akshaya Patra has these kitchens across India. So essentially, that's a big nutritional project that has come through, and the Telangana government, of course, is quite is very proactive in encouraging a lot of corporates to come in and play a role in pursuing their objectives and goals. I mean, can we just, by a show of hands, how many corporates here? Can we just raise our hands? That's about a little less than 10. The rest of the people here, are you all NGO folks? Raise your hands. Oh, lots of NGO folks here. Okay, okay. And the others are miscellaneous. That would be, okay, we probably don't know, unless they're CSR box employees. But the point I'm trying to make is that, all the ladies here, the accomplished ladies here have mentioned the necessity to have these conduits or bridges between these different ecosystems, right? The corporate world, the government, the NGOs, because there are corporates that want to work with the government, but then they don't know how to. Kiska darwaza khatkataएं? How do you navigate this entire process? So I think there are teams like TSIG, like I said, the Telangana government has a CSR cell dedicated for enhancing and speeding up this process of getting CSR funds deployed. We raised about 8.5 crore rupees as on 31st March 2024 for CSR, and now in the new financial year, we're just halfway past the 6-month mark, and we're already at 11 crores. So there's a lot of potential. Somebody was mentioning we are at 30,000 crores every year, right, as far as CSR is concerned. But then in that pie, Telangana is just a small 600 crore. We just have that small piece. So there's so much that can be done in this space from a perspective of raising awareness amongst the corporates that ye bhi yahan pe bhi aap deploy kar sakte ho, or in this space, you should probably explore this particular avenue. So the point I'm trying to make is, yes, there's a lot that can be done, and thank God for all the people in this room, because everybody's going to sort of try and do their own bit.
Like they say, every drop adds to the ocean.
Counts, yes.
I think, yeah, very, very relevant. Usha, I'd like to ask you on, you spoke about being a mother as a beautiful gift. I just want to understand from you, what is the need for women to be nutrition champions? And they are nutrition champions at homes, but in terms of a community health intervention, what is that need?
Thanks, Neha. That's a very important question. And I would say that women champions as Poshan Shaktis, because end of the day, whether it is work from home or work from office, at least I'm talking about right now the working mothers, the first thing, go-to person for a child at home is the mother. Whether you are in a call or a meeting or anything, they come running and asking for your meal or a snack or water or whatever it is. So I strongly also agree with Dhanalakshmi, because women are the core, and they are the influencers, they are the enablers, and they play a major interventionist role in the family. And like Sangeeta said, very much the BCC, behavioral communication awareness, is very important, because we cannot design a nutrition program and invest, because we can't buy vegetables, like Dhanalakshmi said, the kind of food intake that we need to do, we can't do that as a program. And it's not simply not possible. And we need to instill this awareness and sensitization of healthy eating and lifestyle dietary practices, which is nutrition sensitive intervention, needs to be planned. Even in our education system, today women, children, adolescent girls, as Sangeeta rightly said, whether it is the early stage or the infancy stage or middle age group, adulthood or old age, nutrition is the key. And we see so many NCDs and so many other life health problems and challenges in the current context, many infections. So women needs to be sensitized on what needs to be provided inside the family. And this is a million-dollar question for all women. What to, prepare as food the next day, and what is to be packed as a snack box. No, that's a question for all mothers. End of the day at 5 or 6 o'clock in the morning, what do I give and how do I give a healthy diet? So this is very important. One of the doctor told me, nowhere in our country we are, especially the women, it equally goes to men, but women are taught to think about how to balance diet, how to take protein rich and fiber rich and nutrition, micronutrition rich, not by investing on heavy cost effective products. We don't have to eat almonds and cashews all the time. Peanuts are fine. And we need to teach, especially in foundation, Cognizant Foundation, we run a project called Project Shuraksha in few urban slums in Mumbai, where we tell the women, please make choices locally. We request them to prepare recipe books which are more native, low cost effective, just like bananas and protein rich chillas. And we give that awareness to them to enable the mothers to provide that as nutrition food rather than buying across the counter chips and other easy purchase items. So I as a strong believer that women plays a major role in keeping the families, even it doesn't matter whether it is urban or rural or literate or illiterate, it doesn't count. End of the day, it is our choice and it goes a long way. I really felt very sorry when I visited last week in September to one of the Taluk hospitals in Karnataka in Doddaballapura. And when I was interacting there in the labor unit, the doctor there told us out of 100 deliveries in a month which happens in this Taluk hospital, 50% of the current younger generation mothers are themselves seeking for cesareans. And I asked, is there any issue on their antenatal care or any health disorder? No. The doctor straightforward told me the threshold for pain bearing has come down to your younger generations now. So this is the current situation actually. So we need to educate our girls as well as our boys at a very younger age what it takes to be as nutrition champions, and formation of adolescent health clubs in communities, especially when we do preventive program. As Sangeeta said rightly, it's not one time, we cannot see tangible results that we see in any healthcare CSR programs in nutrition. It's time driven, long effort, intense it is. So even from the NGO ecosystem, like our partnerships, we request our partners, we push, right now I push in our collaborations to our partners to put more budget on BCC rather than, spending on events and advocacies which are one time. And KPIs are after and before kind, and it never comes to the dashboard, and it is of no use because ticking numbers is not actually the core subject. Hope I answered, and my colleagues would agree with me. Thank you.
Thanks, Usha. I just wanted to add this very quick line. I mentioned that this corporate sponsored 6.5 crore rupees, 6 crore 40 lakhs for this breakfast program, and breakfast is the most important meal of the day. See, we have midday meals in India, but if you look at stats, a lot of these children who come to the government schools are children from low income groups, right? Their parents are laborers or farmers and in the agrarian economy. So a lot of kids, and we've been told that a lot of children came to school because they got the midday meal. But think about it, you have dinner at a certain time and then you don't have breakfast and you come to school, you have to wait for a good 12, I don't know how many hours is that. You eat at 9 p.m. and then you have to wait for more than 12 hours to eat your next meal. So this particular breakfast scheme or breakfast project that was introduced by Viatris, the company, the pharmaceutical company that sponsored the 6.5 crore project was Viatris. So we are quite happy that there are corporates who are willing to also support these initiatives that make a lot of practical sense. We all have children. A lot of us here have children. My daughter is 13. And if I had to send my daughter to a school, by the grace of God, all of us are very privileged, but these government school kids are getting a hot breakfast of pongal or idli or bonda every day, courtesy HKM Foundation, and that will make a difference to their overall nutrition and productivity in school, right, in class. They'll be able to concentrate better. So I wish more corporates could step up and push the breakfast, needle a little, because it's the most important meal of the day, and nutrition really stems from that. So
Yeah,
thanks.
I'm sure from this room, the corporates who raise their hands will pledge to support nutrition programs going forward.
We're coming after you.
But I think we've heard several perspectives, right? From the corporate, from the NGO, from a government perspective on what goes into designing and implementing a nutrition project. But Dr. Dhanlakshmi, I'd like you to throw some light on the challenges that you may have faced in terms of implementing these nutrition projects across.
Thank you, Neha. And maybe I'll just also take this opportunity to, say when Neha mentions Dr. Dhanlakshmi, I'm not a medical doctor by profession. I am a PhD in agriculture. So that's where the doctor comes from. Yeah. On the challenges part of it, I would like to put it from two perspectives. One is from the community perspective itself, and the other is from the challenges that we as corporates probably, face when we actually implement some of these programs. So from a community perspective, I would call it as the 5 A's. The first A being agriculture. Without food on hand, there can be no nutrition. So it's extremely important to be self-sufficient or produce enough food for the ever-growing population. And there have also been wonderful studies which show that there is a negative correlation between the productivity and the nutrition. Lower the agricultural productivity, higher is the malnutrition. And we've seen that in some of our very own states where, Kerala and Punjab, being the states with high agricultural productivity, have low levels of malnutrition. But if you look at states like UP and MP, where the productivity is low, the rates of malnutrition is high. So that's the first A. The second A is availability. Assume we are producing enough food, but is it available? That's the second A. The third one is accessibility. As a rural person, or do the rural communities have access to some of the nutritious food that they grow? Most often what happens, they grow the food and it's all sent to the urban markets. So do they have access? So that's the third A. The fourth A is affordability. Can they afford the nutritious food? So that's one. The most important of all the A's is the fifth one, which is absorption. So when we talk about nutrition, it's not enough for us to consume nutritious food. But are we taking the right combination of foods? I think that's also extremely important. A lot of us do not really know what foods to eat in I'll try. Yeah, works. A very simple example is the relationship between calcium intake and vitamin D. So calcium gets absorbed in the body only when there's enough vitamin D. And a lot of us today, I'm sure, if any of you have got your health checkups done in the recent past, I'm sure many of us will be vitamin D deficient. Simply because we are sitting within the walls, we are not exposed to the sun. So whatever amount of calcium that you're eating in whatever form is not getting absorbed. So absorption is also extremely important, and we need to have that awareness to also know the food combinations that we need to eat. So that's from a rural perspective. Now looking at perspectives from organizations who are implementing the nutrition programs. Investment. Is there enough investment that's being done for nutrition programs? The second innovation. Do we have innovations that can help deliver these programs at scale? Or today, we talk about technology. So we know there are wearables. The glucometers have changed the life of, testing for NCDs. So is there something like that's important for testing for anemia, testing for something at a very early stage? So innovation is extremely important. And then there is also the monitoring mechanisms. So as an organization, we would really like to know if the amount or the budget invested, if it is reaching the last mile, the last beneficiary. So extremely important to have good monitoring mechanisms in place. And measurement of impact. I think that's also a very important piece. So these are some of the challenges which, a corporate or organizations face when they roll out some of the, it's not just a nutrition program, but when we look at nutrition to be specific, I think measuring or moving the needle on nutrition index. I think that's still a gray area, needs a lot of, study to see how we can measure the impact of nutrition.
Thank you, Dr. Dhanlakshmi. I want to take at least 2 questions from the audience. So very quickly, Sanjita, what are some of the lessons that you've been able to learn through, the interventions that can guide like future interventions for nutrition?
Thank you for that question. Is it working? This is better. That's the disadvantage of being the last one. You're last but not the least. You have 1 minute to summarize. Sorry. So, when it comes to SBC, or because I see a lot of new faces, I'll just say it again, social and behavior change, there are quite a few takeaways, and this is not just about nutrition programs. This is applicable across the board, across thematic areas that CSR organizations may be working on. First thing is, one size does not fit all, right? It's very, very important for us to segment the people we are working for, right? Audience segmentation is extremely important. We can't apply a blanket program to everyone in the community, right? So let us look at not just the demographic profile of the people we are working for, but also the psychographic profile of the people, right? What are their needs? What are their dreams, aspirations? What do they like, dislike? Because if we only look at them as a demographic group, between, let's say, 15 to 20 years of age and so on, it's just going to remain a number. And as CSR organizations, we are often so, sort of focused on the numbers that we forget that, we are dealing with human beings. The second thing is focus demands sacrifice. That basically suggests that while, again, we are very focused on numbers, we are very focused on how much return our investment is giving us, especially in terms of monetary gains, we need to ensure that we are only focusing on a few prioritized behaviors. It's very tempting to focus on 500 different indicators that we want to monitor, that we want to affect through our programmatic interventions, and also evaluate them so that we can get more funding in the future. But let's just focus on 2 behaviors which are most important to change. And lastly, I would say, taking everything or looking at everything from a human-centered perspective. That is very, very critical. Let's keep our audience or the people we are working for at the center of everything that we design. and loop them into the process from the very beginning. Yeah.
Thank you. Any questions from the audience? Yes. Can you also just mention who you want to ask the question to, please?
Sure. Hi to everyone. My name is Tulsi. Thank you for all your insights, the esteemed panel. But my question is to Dr. Dhanalakshmi ji, ma'am. So the point I need to make, and I have a question. There are two parts to the question. I'll make it quick, 20 seconds. The first point is that the targets that your organization has taken in terms of reaching out to different communities, 100 million each in different categories of women and overall people and farmers, the smallholder farmers, is quite humbling, at the same time inspiring. Nutrition, ma'am, I'm coming to my question. Nutrition means different to different people. While modern sciences are extremely crucial to the entire ecosystem for the benefit of the end beneficiary, but would you agree, and if so, that one of the key markers of us saying that somebody is really healthy is the absence or elimination of taking any kind of medicine? Would that be so? And if so, then what are the 2 or 3 things one needs to do, as in us as a whole, as a community? Second part of the question is, while modern sciences are very essential, what do you think, Ayurveda, that's a very deep subject, I know, but do you think also some attention to our long forgotten Indian sciences in terms of food, that should really be given focus? It's gaining focus, but more in terms of impactful, implementable initiatives that could be taken up. So these are some of the thoughts I had, and I could learn from you, ma'am.
First of all, thank you, Surabhi, for bringing out what Bayer is. Tulsi.
Yeah.
For talking about Bayer and congratulating us. Thank you for that. So I will leave the Ayurveda question because I don't think I have the expertise to answer that question on, if we take the right diet or the right kind of food, we do not need to take medicines. So, well, this is my personal opinion. I would believe that we probably do not get all the essential minerals and nutrients that we would need from our daily diets. So I would still feel there is probably a need to take a bit of supplementation, but that only at a later stage of life, not right from the beginning. So up until a point, and I'll take it from my own perspective. So especially for women, I think, and going back to the calcium absorption, I'm told that, women can absorb calcium and the bones can get the calcium up until age 25 to 30. Beyond that, the absorption capacity itself reduces. So that's where I think it's important to take supplements, but maybe at a later stage in time. But for the children, I'm sure we should be able to manage their nutrition with the kind of food that we feed them.
Thank you. Thank you for sharing that.
Thank you, Tulsi.
So the last question, one last question, please. I have a gentleman there who's raised his hand.
Check, yeah. Hi, so I'm Charan. I'm from Wilgrow. We work with innovations to solve solutions. This is a little more on healthcare as a overall, not specific to nutrition, and it's open to the whole panel. So there's a lot of talk about innovation, affordability, accessibility. So I just want to know how open is CSR to working with innovations in the healthcare space, and how open would they be to working on an infrastructure that actually makes it accessible and affordable to the underserved in rural spaces? And if anybody on the panel has already worked in such cases, an example of an innovation that you worked with, or something that makes it more affordable and accessible in the underserved or rural space.
Archana, Usha?
Should I take that? Hi, I'm sorry, I don't know your name. But to answer your question, I think it just depends on how compelling the case is. If you're able to convince a corporate about the impact that innovation will have in terms of number of recipients, beneficiaries, or in terms of ROI, I don't know whether that's a marker here, but then really it has to be very tangible, it has to be very black and white. If you have to tell a corporate that, by including this innovation, it'll actually benefit these many people in underserved communities or in the rural areas or the underprivileged. So that is one, corporates are willing to listen. You just have to, like I said, give them enough data and data points to make that informed decision. That is one. Second is, there was this one case of the drones being used to drop medicines in the rural areas. See, it was launched with a lot of fanfare, and I'm talking about, I'm sure this has happened in different states in the country, but these innovations, so to speak, don't take off because the costs become very prohibitive, right? So again, innovation is one thing, but we also have to think of whether it's sustainable, right?
No,
If it's long
yeah,
term.
but also adding to it, like to work with
I'm
maybe.
really sorry. I'm really
Just
sorry.
one last-
And
just
we are
one
really very
last
thankful for the
thing.
question.
Bhaumik is
you
here
know.
and he's like, close the shop.
Bhaumik has walked in like a school principal. Now we all just have to sort of stop
But,
talking.
okay, I would encourage you all to catch hold of all the panelists and ask your questions there. This session has ended sooner than I would have liked for it to end.
I can answer the gentleman, maybe he can
Offline, you can
the
do
corridor
that.
and
Yes.
It is
Thank you so
possible,
much.
yeah.
Thank you so much, each one of you, for being so candid and bringing out your experience, insights for the lovely audience here. And thank you, the audience, for being so amazing. Thank you, Bhaumik, for giving us this opportunity.